Basically, it's a study to try to understand the root causes of seafarer illness and injury. The idea being to reduce the repatriations of seafarers, so to prevent them from being ill and to therefore reduce the costs to the owners of the ships. And we believe in trying to push the medicine upstream, meaning we want to try to get illness early, and if that is much better than late, it costs less and the people get less ill, and eventually to get to prevention where they don't get ill at all. And so we're looking now at data from pre-employment medical examinations to try to see if we can figure out predictors of people having a higher probability of becoming ill on board. More recently, as technology has improved, we've started to take use of that technology, and we're trying to, in essence, put a general practitioner on board, but we're doing it virtually. So telemedicine allows us now to reach right on board the ship. So when someone has a problem that the captain doesn't understand, he thinks it's important, they reach out, and through FutureCare, for one company that does this, they reach out and get a doctor on the other end who can help diagnose the problem very quickly, early, and give appropriate treatment.
What we are doing is bringing the maritime world and medical health care for the seafarer into the 21st century through managing care and through telemedicine, allowing for contact between the physician and the seafarer while at sea, as well as ensuring that after he's discharged, in the event of illness or injury, care is provided until he or she reaches maximum medical improvement. So that's the service that we bring to the ship owners. We also provide auditing services and monitor bills and review charges in order to ensure that the seafarer obtains the highest quality care at the lowest available price. The Caring for the Crew program is our managed health care for for international seafarers. Our primary goal is to be available to the seafarer at the moment that there is a medical need, whether it's emergency or primary health care, and to manage the response from the time on board ship all the way through to onshore treatment if it's necessary, outpatient treatment if that's necessary, rehabilitation, and ultimately a return to fit for duty. Our primary health care program is to provide medical advice and diagnosis while the crewman is on board ship to regulate and ameliorate any chronic conditions and prevent them from escalating into something more serious for the crewman and more expensive for his employer.
FutureCare is a medical case management company that provides physician advice at sea to captains and fleet operations. We also provide landside concierge to the appropriate hospitals or facilities globally so that the seafarer, whether he is at sea or will be on land at some point, his medical issues will be addressed in the proper manner by the proper experts. Over the years, FutureCare has received many catastrophic assignments from P&I clubs because our specialty is medically case managing from the beginning of a medical incident to ensure that the crew member reaches the proper medical doctor and receives the proper medical treatment. So for many years, FutureCare worked on developing a network of physicians, hospitals and clinics where we feel the quality of service is excellent. Internally, FutureCare uses physicians, advisors who we patch in to speak to our captains at sea, and we use trained nurse case managers who work with the crew member and the treatment facility so that we understand early from the onset of the incident at sea and through to the treatment at port what the issue actually is, the diagnosis, the prognosis, and the treatment time frame, and we assist our team of fleet operators or P&I clubs in returning the crew member fit for travel home with repatriation in the proper manner. Or we resolve the medical incident and are able to return the crew member back fit for duty. Well, we will always have our catastrophic incidences to deal with, and I would have to say from the study of Yale School of Medicine and FutureCare's cases, 65% of all our medical calls are illness-related. Those illnesses, a big percentage of them are for skin, genital urinary problems, stomach issues, and heart conditions. Most important is that though a crew member receives a proper pre-employment physical, he may be in a 2-year cycle before he is re-seen for an updated pre-employment physical. That means he comes on board with normal medical issues that you and I may suffer from: colds, flus, belly aches, aches and pains from age. But most importantly, with our program, our ship owners are allowing the captain to address primary health care needs. So if the crew member wants to address an ache or a pain, minor ailments, a headache, we encourage that they are entitled to have access to our physician. This allows for small direction of care to the captain. We render support. We help him choose the medical prescriptions from the medicine chest, and we monitor the crew member while on board the vessel. And that is the key to not allowing a small medical incident turn into a large emergency. Again, humbly speaking, we see it all. Well, Globecom has introduced a service called Live Access Chat. It's available for ship owners who would like to allow their crew to talk to their family. It has a reduced signal, so charges are lower to use that service. And also we have Chat Plus for FutureCare Live, which allows our physician to actually see the crew member and the captain or the officer and to talk to them face-to-face like you would in Skype. And so this will be an advanced method to help us with diagnosis, and we do look forward to introducing this service to many of our ship owners.